Today we're out here in Colorado Springs, Colorado at the Clinical TMS Society Conference. Today we're going to be talking with doctors, professionals, and the question of the day is, does TMS therapy really work?
My name is Brett Scotia. I'm the Vice President of Sales for NeuroCare, which we manufacture and sell the Apollo TMS system. I've been in the industry for over 12 years and have sold 10% of all the active devices in the world.
Does TMS really work?
Well, I've been in the industry for over 12 years, and you could see results that when you see patients and you're like, I don't know if anything's going to help this person, and you see people get better. And when you see some of the remission rates of like 45%, I mean, there's a study that was just done by NeuroCare that had 65% remission rates at 6 months, and that's due to NeuroCare's, they're looking at more than just the TMS part. They're looking at sleep and how to improve sleep in patients, and they got 65% remission rates.
That's wonderful.
I'm June from Yingte, the VP for Yingte.
The biggest question that we always get, does TMS really work, right? Yeah. Is it the placebo effect?
Okay, so we have been doing this TMS in China for many diseases, and in the clinic for like depression, OCD, stroke, Alzheimer, Parkinson, and many diseases is still evaluating in the clinical process. And right now, the most widely used is for depression and OCD. It's much more effective than drug, we think. Mm-hmm. For some drugs, they have it's fine. For 35%, the patient 75% the patient can get better when they take some drugs. But from our evidence, the TMS is more than 75%.
My name is DeLuca. I'm the Director of Operations and Director of Training for PeakLogic, Inc., which is a medical software company as a medical device. And we offer PRTMS, which is personalized repetitive transcranial magnetic stimulation.
Does TMS or PRTMS really work?
My personal answer to that is yes. I've been doing this for 7 years. I've seen hundreds of client testimonials ranging from, my quality of sleep is improved. Our poster here is based off of a retrospective analysis of sleep improvement. But in addition to that, anecdotally, people come to me and say, I'm thinking clear, I'm thinking sharper, my mood is improved, I'm, happier overall. So it can vary from, emotional regulation and improved sleep to you saved my life, and so client testimonials that's what keeps me going. That's what keeps me passionate about this job. In addition to that, PeakLogic has done retrospective analysis of many different indications and how PRTMS has impacted those neurocognitive surveys. And we see great success across the board with, the FDA-approved MDD, as well as other off-label indications such as sleep improvement, concussion, PTSD, and things of that nature.
Yeah, so my name is Jake Buchanan. I own a company called TMS Marketing Solutions, to where we help TMS practices find more TMS patients.
Does TMS really work?
That's an amazing question. Yes, it definitely does work. It doesn't work for everyone, but it works at a high enough rate that it deserves your attention if you're struggling. If you're someone with depression, who has struggled with depression, who has tried medications, who has tried therapy, and those things haven't, cured your depression, it's 100% worth it to look at TMS as an option, because we've seen it work just countless times in those situations.
Right.
My name is Rayma Wright. I work with Seberg's Medical. It's a German-owned company. He's been in TMS for 14 years.
The big question, does TMS really work?
I have been really successful with TMS with the doctors that I've worked with and the machines that I've had that I treated patients with. And I am happy to say that we had a 5% failure that came back, and they are now all depression clear.
Thomas Cassat, third-year medical student at FAU College of Medicine. Nice to be here.
Does TMS really work?
Absolutely works. And it's not just my opinion, that's backed up by scientific and clinical literature. So it absolutely works, Kyle. I can tell that with certainty. And all those of you out there who aren't sure if it's a kind of, woo-ha or kind of a new thing that hasn't been tested, it has been tested. and it's been established it's effective. So if you or a close one has major depressive disorder, just reach out to your closest TMS clinic, and that'll definitely help.
Perfect. Does TMS therapy really work? I'd say 100% yes. I am a true walking testament to the fact that it does. But you heard it from the professional's mouth. Yes, this stuff works, and it will help you in your daily life. If you have any questions about TMS therapy, leave a comment in the section below. We're happy to communicate with you and answer any questions that you may have. And make it a great day.